COVID, it's making a comeback. Cases of a new Omicron subvariant called JN.1, well, these cases are rising worldwide. In the wake of the surge, the World Health Organization has urged the nations to continue with the measures to curb the virus. Now, we have been telling you about the rise of cases in India. Let's focus on India as of now. 142 fresh cases have been reported across the country. The southern state of Kerala has reported the highest, 115 cases, along with one death. Another death has been reported in Karnataka as well. The central government has issued a vigilance advisory to all states. Karnataka has now made masks mandatory for all citizens above the age of 60. Among the several nations witnessing the rise, Singapore has recorded 56,000 more COVID cases in last week, up to December 9th. Cases have risen from 32,035 in the previous week. The vast majority of cases are infected by JN.1 variant. This has prompted the Health Ministry to issue an advisory for citizens and travellers. Then in Europe, UK is now preparing for a potentially devastating wave. Experts have warned that the new wave here could be one of the worst since vaccines were created. Cases are spreading as Brits' immunity levels are waning. Almost 6,000 people have tested positive throughout England in the week up to December 9th. Now, this marks over 38% rise compared to the previous week. Then let's take a look at Germany. Even here, infections have reached at the highest levels since June 2022. JN.1 subvariant is reportedly responsible for almost a third of these cases. While the risk to the general population has been deemed low here, Health Minister has urged people to get their vaccinations topped up. Now, in the United States, 17 states have reported high or very high levels of respiratory illness activity as COVID-19 and other flu hospitalizations have increased. COVID-19 hospitalizations rose to 23,432 according to data published up to the 9th of December. An alert has been issued to healthcare providers, encouraging them to administer COVID-19 and flu and vaccines as soon as possible. Meanwhile, China has detected 7 cases of contracting the subvariant JN.1 in about a month. The infections in China are at a low epidemic level as per health authorities. However, experts have warned that more cases of the variant are expected. The JN.1 subvariant is a descendant of the BA.2.86 variant of COVID, commonly referred to as Pirola. Symptoms of an infection include fever, nasal discharge, throat infections, migraines, and mild gastrointestinal issues.